So today I'd like to talk about mold and mycotoxins. So this is a controversial area. Most of the general medical community doesn't really understand the impact of mold exposure on illness. Sure, people will talk about allergies and being in an environment that might trigger asthma if you happen to be in a moldy environment. But uh, anytime we talk about a controversial area, I say that the way that we find our way to the truth is two things. To number one, look at the published literature that's in peer-reviewed medical journals, and number two, look at the clinical experience of practicing physicians in the community, because I think it's important to look at both of those to get a very clear picture. Are we dealing with something that's true or false, first of all, and then second of all, does that finding make its way into clinical practice? So, mold has been spoken about for thousands of years and been experienced for thousands of years. And so there are actually references to purification rituals for mold in the book of Leviticus in the Bible, so thousands of years ago. And of course, people have coexisted with fungal species throughout time immemorial. In fact, fungi are probably the most successful and resilient life form on the planet. So, what's the deal with mold? So, obviously, people really hadn't talked much about mold until the last several years, and there's several reasons for that we'll uncover in a bit. When we talk about mold, what makes people come into contact with mold? So, there are outside molds and fungi. Those that don't tend to affect human health, although if you are anywhere where there's a red tide, uh, particularly along the Gulf Coast, Florida, those areas, occasionally there will be a red tide. It's not safe to swim because the cyanobacteria in the water will produce a type of toxin. And so that can have adverse human effects. In fact, I've had patients who returned from, for example, a spring break trip where there was a red tide and would report being on the beach and having trouble breathing and being severe headache and very fatigued from that chemical immune phenomenon. So what about mold in homes? So there are two conditions you can have that can lead to mold growth in a home. So first of all, there's mold everywhere. So it's in every home, it's in every building, it's in your car, it's everywhere. And so what I mean by that is there are mold spores. And so the wall behind me here has had mold on the building materials when it was built. Now we cover that with latex paint and etc. And so there are mold spores everywhere, but they are largely dormant and don't do much of anything when it comes to human health. When mold comes in contact with a higher humidity condition, it can multiply, then it can release different chemicals. It can release mycotoxins, which are small organic molecules, and other volatile organic compounds. So if you've ever been in a basement, for example, that had mold, you might notice a musty smell. And I tell people that mycotoxins, the poisons released by mold, don't have an odor to them, but the volatile organic compounds, the swamp gas sort of produced by molds do, and that's what gives you a moldy or musty smell if you happen to be in a place. So when we talk about an increase in humidity, there are two conditions really where that can happen. The first is you can have a water leak. So you can have a water leak from a ceiling, a wall, a plumbing fixture. Perhaps your sump pump in your basement goes out. And then the second problem that you can have is that you can have high humidity. So if houses have humidity over 50%, typically that can harbor or lead to microbial growth within the house. Now, when it comes to a leak, what's a significant leak? Well, a significant leak is a leak anywhere that leaves a stain in your house. And so if, your sump pump stops working some night, the basement floods, you immediately find it, clean it up, dry it out, put fans out, that type of thing. A lot of times you can avoid any problem whatsoever. Just completely takes care of things if it's done within maybe 24 or 48 hours. But if water or a leak sits longer than that before you know about it, that can be a problem. One thing I will say is that, in the 80s and 90s, it was very vogue to build a home with a whole home humidifier. Those, most of the time, if you take them apart and look, are chock full of mold. So there are multiples. I encourage people not to use those. There are multiple different types of molds. The molds we're talking about from water damaged buildings if you look at the medical literature, all have effects on human health. So if we look at the medical literature closely when it comes to mold and mycotoxins, we can see that mold does several things. First of all, it is an immune suppressant. So when we look at that, if you know anyone who's had a transplanted organ, a liver, lungs, etc., many times they're on Cellcept, which is a drug, and that drug is actually mycophenolic acid, which is a mycotoxin. In fact, if you test people, do urine mycotoxin testing, if they've been in a moldy environment, many times they will have elevated levels of mycophenolic acid, which is Cellcept, and it's an immune suppressant. That's why it's used for organ transplantation, so you don't reject the new organ that's been put in. Mycotoxins have also been shown to stimulate an immune response. So in our practice, we found that there can be a trigger of autoimmunity. I took care of one family several years ago where the whole family came in with very concerning complaints, confusion, headaches, joint pain, and we tested them. And both adults, but the mother and the father, and several of the children had elevated levels of anti-nuclear antibody. That's very strange. And that's a marker that we see sometimes in autoimmune conditions. When they got their house remediated, it all went away. Their symptoms went away. Their, ANA became negative. So it's interesting that mold exposures can also lead to autoimmunity. We also know that mycotoxins and mold can have deleterious effects on the lining of the gut. And so, in times in the past when there were large exposures to mycotoxins, 1948 in Russia after the Second World War, there were over 100,000 people who died due to grain that had been rotting during the war that they then ate and had massive exposure to aflatoxin and ochratoxin and actually had gastrointestinal bleeding. So it can affect the lining of the gut. So that is also in the medical literature. We also know that mycotoxins can cause hormonal disruption. There's not enough of this literature in the published medical literature specifically to cite, but I can tell you clinically, as someone who's taken care of thousands of patients with mold exposures over the last probably 15 years, I can tell you that we've seen this in a matter of times where people will have irregular menstrual cycles or will have low testosterone. And once things are improved and they're moved out of that environment, their home is remediated, then improve. So in terms of testing, another controversial area, I can tell you clinically in clinical practice, urine mycotoxin testing we found to be fairly accurate. When mycotoxin levels are high and people are in that environment, if they move out of that environment, those levels will drop. And you can help that along by using things that help remove mycotoxins from the body, things like glutathione and acetylcysteine, as well as binders, orally absorbed binders, things like charcoal that we would use to absorb other drugs and things in the case of drug overdose or things like that. So all those things can improve, but the most important thing is to get people's house appropriately inspected and remediated. And so along those lines, spore testing alone isn't really enough to look for mold. It's best to get someone who's qualified, an indoor environmental professional or IEP. And you can find one of those by going to www.iseai.org. And so that is an organization Dr. Ellen, Antoine, and I helped start. We were some of the founding members of that organization, and it looks at the environment and how it affects people. So plenty of literature. There are also several published articles on sick building syndrome and the effects of mycotoxins and mold exposure. In addition, there is at least one article, I believe it's from Tufts, which discusses neuropsychiatric effects seen with mold exposures. So you can find all of those references in blogs on my website, thepandas.com. You can also find those references as well as total over 1,200 references in the Comprehensive Physician's Guide to the Management of PANS and PANDAS. And so all the information about mold and mycotoxins is in there. And so I hope this information was helpful to you. If you're questioning, could mold be affecting my health? Could mycotoxins be affecting my health? If you head to that website or to our main website, which is fullyfunctional.com, you'll find a lot of information there. And should you choose to make an appointment to come and see us, you'll find information on fullyfunctional.com to do that. Have a great day.